supermarket. A new government study has found antibiotic-resistant bacteria, what we now call superbugs, like some of the most popular cuts of meat. But there's also good news. You know exactly how you can protect your family in just a few simple steps. Heather White is the Executive Director for the Consumer Watchdog Organization Environmental Working Group, and Dr. Urvashi Rangan is joining us, Director of Consumer Safety from Consumer Reports. They're going to be tackling this issue as well. Let's start by looking at the new government numbers. Of the samples they tested, antibiotic-resistant bacteria were found in, listen carefully, 81% of the ground turkey looked at, 69% of pork chops, 55% of ground beef, 39% of breast, wings and thighs from chicken. I mean, these are huge numbers, Heather. What types of bacteria you're finding? I mean, how dangerous is this?
Well, if you are buying meat in the supermarket, you are likely exposing yourself and your family to superbugs. These statistics are very alarming, but they're not new to FDA. The government found first antibiotic bacteria that is really concerning because it's an indicator, this is in the slide that you just showed, it's an indicator that the meat has had contact with fecal matter. It also is an indicator that there could be other antibiotic-resistant bacteria on the meat. Also with Salmonella and Campylobacter, which are responsible for 3.6 million food poisoning cases a year. And then we found, finally, antibiotic-resistant E. coli bacteria, which, as you know, can cause diarrhea, it can cause urinary tract infections, also pneumonia, and even in rare cases, death. And if the antibiotics that are used to treat these illnesses don't work, we have a serious health problem on our hands.
Dr. Rangan, I mean, how does this happen? How do we get here?
Well, we actually did it. And the reason we did it is because our meat industry feeds healthy animals antibiotics every day for a couple reasons. One, it prevents disease. Two, it seems to promote growth. So we have this practice here where we feed animals low levels of antibiotics on a daily basis, kind of keeps things clean, makes them bigger faster. But that is exactly the kind of mechanism that promotes resistance in these bacteria. So getting little pulses of antibiotics all the time doesn't kill the bacteria, it teaches them how to become resistant to it. Once those bacteria are out in the environment and they have that resistance, they can share that resistance with other bacteria. They can even share resistance with antibiotic classes, and that can start to move the resistance even wider than it already is.
So Heather, what makes these bacteria so uniquely dangerous to us?
Well, these superbugs are resistant to most commonly prescribed antibiotics. So if you come in with a routine bacterial infection and your doctor writes you a prescription, it may not work. So this routine infection could become a medical crisis overnight.
So the Environmental Working Group released a report on this that was partially underwritten by Applegate. It's a company that sells organic and antibiotic-free meats. We also reached out to the FDA, and what they said essentially is that they believe the report oversimplifies the data, but they understand it's a serious issue. They say antimicrobials should only be used to ensure animal health and not to promote growth. To read the full statement from the FDA, come up on DrOz.com. Dr. Rangan, in the meantime, you're so good at giving us practical advice. Well, what can folks at home do to avoid falling prey to one of these antibiotic-resistant bacteria?
There's definitely things people can do, and that's the good news. So our first bit of advice is buy meat that is produced without antibiotics. There's a lot of ways to do that and a lot of labels that can get you there. The first one is raised without antibiotics, but remember it's a general claim out there and it's not always verified. Organic is definitely a surefire verified way to get that. Animal welfare approved, certified humane, also labels that do prudent use where only sick animals are treated with antibiotics. There's also the Global Animal Partnership, also sold at Whole Foods, that can also guarantee that antibiotics were not used. Finally, kitchen handling is a big, big issue. What's really interesting in pork with Yersinia contamination is that the group that gets sick the most are under the age of 1. And what that should tell us is it's how we're preparing and how we're cleaning ourselves before we handle food for our family members that really matters. And so how you handle that meat, careful hygiene, using a dedicated cutting board for meat, putting it in the dishwasher, and when you buy your meat, get a bag, put it on your hand like a glove, grab the meat in the package, and pull it over the meat package. And that way, you're not contaminating yourself while you're shopping either.
Yeah, fantastic advice. Thanks for doing the work to bring us to our attention. Coming up, the healthiest art on a plate. You've got to see this to believe it.